Hello, everyone, and welcome to the second week of the breakout sessions of the virtual Iowa Governor's Conference on Public Health. I'm so glad that so many of you are back with us this week, and it looks like from the numbers we have some more people, some new people. So welcome, welcome, welcome. As you know, we usually meet in person the first week of April, but like everyone else, the coronavirus has caused us to pivot and adjust, but we have not let go of our commitment to learning and sharing best practices and lessons learned, and just really learning from the experts we have here in Iowa. So last week we had nearly 500 people join us for either the keynote or some of the breakout sessions. And so obviously there's a strong commitment across the state of Iowa to learning from our peers. So again, thank you for being here. My name is Lena Tucker-Reinders. I am the Executive Director of Iowa Public Health Association. IPHA is one of the co-sponsoring agencies, organizations of the Governor's Conference every year, along with Iowa Environmental Health Association. And if you're not already a member of Iowa Public Health Association, I welcome you to join us. It is through the membership across the state of Iowa that we're able to do things like this. Our mission is to unite and strengthen the voice for public health in Iowa, and that's exactly what we're doing here today. I also want to thank our sponsors of the virtual Iowa Governor's Conference on Public Health. It is their support that's allowed us to pivot like we have and to still bring you the content from around the state. So thank you to Aetna, AmeriGroup, Unity Point Health, and the College of Public Health. Your support for public health is paramount, especially in these times. I also welcome everybody to visit our virtual exhibitors. Normally when we meet at the Holiday Inn here in Des Moines, you walk through the Hall of Exhibitors and see plenty of tables with interesting stuff on there, interesting information. Some of our exhibitors have gone virtual along with us. You can find that list of virtual exhibitors on the Iowa Governor's Conference on Public Health's website on the Iowa Public Health Association website. So with this, today we have two presentations today, both of which are eligible for CHES and dietetics continuing education. If you are seeking that continuing education, please put your name in the chat window along with your CHES or dietetics number, and I will be sure to follow up with you directly. The second presentation also qualifies for nursing credits, and I'll remind you on that when we get to there. So just before I quickly introduce today's speakers, just a reminder that everyone is on mute, and the chat function is set so that you can only chat with the presenters, and that's of course to ward off any Zoom bombers. Hopefully we don't have anybody on the call today that will do that, but just in case, the chat function is enabled so you can send a message to the presenters. At the end of each presentation, there will be time for questions, and I will read those and then ask the presenters to respond accordingly. So first, let's go ahead and introduce our first presenter today. Caprice Jones is with Fountain of Youth Programs in Dubuque, and he's going to talk to us today about what they are doing to stop intergenerational poverty. So without further ado, I'll hand it over to Caprice.
Do I have to pull my screen back up?
Yep, go ahead and share the screen.
Hold it.
We're all getting used to the Zoom technology here.
Okay.
There you go.
Perfect. Hello, everyone. My name is Caprice Jones, and I am the Executive Director of the Fountain of Youth Program located in Dubuque, Iowa. And our mission is to change the mindsets that contributes to generational poverty. And when we use the term mindsets that contributes to generational poverty, not only do we want to educate individuals that's been trapped in generational poverty of how to come out, as well as we want to educate individuals that's never been in generational poverty of how not to become someone that keeps allowing people to stay stuck in it. And so my presentation, I would like to start off by saying we're in an unprecedented time in history, And I think that it is unfortunate that we have to experience this in life, but I also think that it kind of supports a new opening for being innovative. For my theory, and my theory is the Band-Aids must come off, because for far too long we've had the Band-Aid approach to dealing with poverty. Hold it. Now I'm trying to, okay. And as you can read this, the greatest service you can do, the greatest service you can give to anyone in need is emotional support, allowing the person to ventilate and validate by discussing their true reactions to traumatic events. You can help them, I guess, progress the crisis. I can't see the word. The crisis logically, process the crisis logically, and once they regain a sense of purpose, they can take control of smaller and eventually larger tasks in their life. So this is very vital to my argument that that a person needs an opportunity to heal. If they've been through traumatic experiences, and we all know that poverty is traumatic. It's traumatic for an individual that's affected by it, and it's also traumatic for our society, because in turn, society is affected by the outcomes of a person that's trapped in poverty. Whether it's in Chicago, I'm from Chicago originally, so whether it's someone running up to your car on the interstate asking for change, or asking for some type of clothing or things of that nature. And sometimes it's very saddening to see the effects of how a person's life is basically torn apart through survival mode. So the Founding Youth Program, the mission is to change the mindsets that contribute to generational poverty. And our vision is to eradicate poverty through community collaboration, resource sharing, and mindfulness. The Founding Youth Program, we have our core program is called Partners in Change, which is a minimum 60-day to maximum 6-month commitment from an individual that has exhibited that they either want to change, they're working on change, or they're already walking in change. And we meet weekly with them with a one-on-one approach. It's an authentic peer approach, meaning that someone could basically meet them where they're at with being able to empathize with their situation. Because I truly believe that even if a person has never even experienced generational poverty, as a human being, we've all experienced some sort of trauma, as well as poor thinking decisions. Because, as humans, we all constantly learning. And someone has been through something. A person that's rich has been through depression. A person that's poor has been through depression. It's just a matter of how do they actually get it treated? Do they have an opportunity? And I'll tap into that later on, which is equity. So we have weekly meetings with Founding Youth staff, and it helps participants personally and professionally and change their own mindsets to end generational poverty. So I truly believe that a person that's trapped in generational poverty, whether they're young or old, they need an opportunity to grow up the right way, meaning their brains have to develop. They have to have experiences to personally develop in order to go to the next stage of professional development as they get older. And so individual success plans, we set those. So our participants, they create SMART goals. And these SMART goals is something where they have an opportunity to challenge themselves by being challenged by someone else to hold them accountable to what they say that they want to achieve in their own life. That's very vital and it's very important in order for a person to heal from the wounds that's been plaguing them for many years. Okay, so the Fountain of Youth, we have support groups. We got them called Getting in Tune with Self, Creating Change from the Inside Out, and Real Talk. And those titles are straight to the point. Getting in tune with yourself is basically a personal maturation approach to a group setting where individuals could examine if they've actually have paid attention to self-reflecting on if they've grown up, not just externally, but internally. Because a lot of people, growth processes have been hindered through traumatic experiences and events throughout their life if they've been trapped in generational poverty. Or if their family has promoted that generational poverty was not really much of a big deal. And I'm gonna tap into that as well as we go along, because it's a lot to generational poverty that a lot of people don't really understand. Creating change from the inside out is an approach. It's a community approach. And so we have people that's from the marginalized community of Dubuque that comes together with individuals that's from different social and economic classes and statuses in Dubuque. We have the chief of police come. We have the board of supervisors come. We have the city manager come. We have everybody could think of to be in the same room with individuals that has not been thought of in most instances, and have not really given themselves much thought to think that they too can be in a setting with individuals that has never been around them. We bring them together. It's a beautiful experience. And Real Talk is our #1 program that we began back in 2017, and we started at a halfway house down here in Dubuque. And Real Talk, it focuses on critical thinking as well as cognitive behavioral thinking patterns. And so we have Real Talk, literally. So when I say Real Talk, it's strictly meant to address issues about life from a real standpoint. All guards are down. So there is a need for Band-Aids, a need for temporary assistance, because as human beings, according to Maslow's hierarchy of needs, this is something I share with my participants as well. Whoever comes through the doors of the Fountain of Youth, they begin to learn about things. They have opportunities to be exposed to things that they've never been exposed to in a regular setting that they're used to. So they get to learn about things like Maslow's hierarchy of needs. You'd be surprised the people that I talk to that has never even heard about it. But yet this is something that their life is a part of this cycle, a system for a human. And so the first stage is the basic needs. And that's where we're at right now in history. Basic needs. The Band-Aids are very, very necessary because people need to survive in order to get to a point where they can learn how to live. So we got to have people surviving in order to live. So physiological needs are breathing, food, water, sex, sleep, and excretion. But there's also the next stage, which is safety, security of body, of employment, of resources, of morality, of the family, of health, of property. That's the second stage. So after a person has received their bare necessities to survive, that ain't the end. We can't stay stuck there, by no means. And I'm gonna show you why. Now, the third stage is love and belonging, which is friendship, family, sexual intimacy. And fourth is esteem, self-esteem, confidence, achievement, respect of others, and respect for others. And the third stage of a man's or woman's individual growth process as a human is self-actualization, which is morality, creativity, spontaneity, problem solving, lack of prejudice, acceptance of facts. That's the process of growth, the growth and development of a human's lifespan. And this is what my theory is, which is I believe that in America, we need to begin to start looking from a lens of a holistic approach. And I'm not speaking from a holistic approach as far as like with the medical term of holistic. I'm speaking from a holistic approach, all around desire for man to reach their highest points, for a person to discover their purposes, not just to wander through life, because that's kind of like a wasted life or a worthless life. And so this is what Maslow hierarchy of needs. It says Maslow argued that the failure to have needs met at various stages of hierarchy could lead to illness, particularly psychiatric illness or mental health issues. Individuals whose physiological needs are not met may die or become extremely ill. When safety needs are not met, post-traumatic stress may occur. So if we keep people stuck by just constantly just focusing on providing just food and water and things of the bare needs of a human being, which is very necessary, but it's not the end to everything. We have to provide a way beyond that stage, according to Maslow's hierarchy of needs. If we don't, then what we're doing is we're neglecting our responsibilities as leaders. We're neglecting our responsibilities as moral individuals. We're neglecting the rightful process for human beings to achieve their purpose. So, need to understand unresolved trauma, generational poverty. When I first started the Founding Youth Program, I had realized that a lot of individuals had not even known what generational poverty meant, but yet they was trapped in it. Some people just settle for that that's just the way life is. And they never challenge themselves to see a better life for themselves. So what they do is settle for less, thinking it's the best. There's a need for healing. People become comfortable. So say for instance, a person becomes very comfortable with being uncomfortable. That's like someone that's going in and out of jail, but yet they say that they don't like jail, or yet they say that they're better than what they've been settling for, but yet they become comfortable with the decisions, because one thing about human beings is humans are creatures of habit. That's a known fact. But we also know that habits have to form. And that's what the Founding Youth does. It challenges people to form healthy habits as human beings. That's how change come in. So purpose beyond circumstance equals equity. So if a person has a purpose that's beyond their circumstances, I define equity as opportunity. It's an opportunity. Equity has allowed a person to be met right where they're at. So it don't matter if they start on the ladder at the bottom of the ladder, but if they given opportunities, they could push themselves to reach the top. Whatever they have inside of them that's purpose to affect this world and impact this world in a positive way, they have to be given an opportunity to make those things happen. If not, we give them excuses. And excuses only excuses a person's responsibility. So real talk, it focuses on cognitive behavior, critical thinking, and self-regulation. A person has to be ready for change, working on change, or walking in change when they walk through our doors. And that's those who we want to serve. We don't want to serve someone that's not even ready for change, because what we're doing is we're being unhelpful for them to discover the process to even be ready for change. We don't want to waste time. We don't want to waste their time. We don't want to waste our time, and we don't want to waste time, period, because time is vital. This is my story. As you can see, I was 20 years old. I was in prison. I know you probably have heard the way that my presentation is. It's not a polished presentation. That's your typical traditional presentation. I've had to learn to overcome my disabilities that was caused by me growing up in poverty. And my disabilities was I didn't have the opportunities to learn how to speak properly or give presentations. Now, when I came a certain age and I realized that I had the ability to think beyond my situation and my circumstances after doing 15 years in Illinois Department of Corrections, I began to start killing the excuses. I couldn't wait on no one else to begin to show me how to change my life for the better. As a small child in Chicago, I used to think, why was I poor? Why was I born poor? I didn't understand generational poverty. I just knew that I was poor because I didn't have the things that everyone else had that was around me. As far as like my teachers, as far as like people in fancy clothes, or maybe the psychiatrist that I met when I was a kid, when I was in a behavioral problems facility. They seemed like their life was way better than mine. But for some strange reason, when my mother used to give me books of food stamps, all my peers and my cousins and things like that, they was happy to get food stamps. I hated to get food stamps. I didn't know why. But I felt that that was something that was like not something that I wanted to get like comfortable with. I knew there was something greater beyond just settling for a handout. We needed a handout, but I needed to discover a hand up. And it took me a long time to realize that that was very necessary for me to have to discover for myself. Because at that particular time in American history, there was not an all-out approach on trying to show someone who they truly was meant to be. So as I went through my own self-reflections, this is what happened. I changed. I became a father. I became a husband. I became a true friend. I became a positive, productive person in society. I became a part of the solutions and not a part of the problems anymore. And what I became was a game changer. And I'm a founder of a nonprofit that tries to encourage and help individuals to challenge themselves to become game changers as well. What do we do in group? We facilitate, we coach, we nurture, we encourage. In real talk, we keep it real. We talk about things that people don't want to talk about. We talk about the things that people are afraid to talk about. We don't be afraid to change. We put it all on the table because my approach is real talk means your life is on the line. If you don't change, no one can change you. And that's the approach that I have with my participants. I teach them everything that I had to learn while I was in prison to change my own self. I had to come up out of gangs, I had to come up out of a settling for less mentality. Because when you expose a person that's in the hood that's settling for less thinking it's the best, because the drug dealer in the hood is not considered the bad guy. A person has to reach self-actualization to be able to start questioning those things and being able to size those lies that was told just to get by is not being the way to live. But how can we ever make it past that if a person is only stuck at square one? Survival. We tend to the conversation. I asked them, what do you think? Can you say more? What about that makes you think that way? I challenge them to start thinking. And what I'm doing is I'm beginning to show them that they matter. It don't matter who they is. It's whoever's in poverty. When I say show them that they matter, I'm talking about all lives. Because in America, one thing is not shown is that it's bigger than skin color. Poverty don't discriminate. So when I say you matter, by asking them, who are you? Who are you? That's when they begin to question and say, I am somebody, because of the things they're being exposed to. So real talk is real talk. And so I asked follow-up questions. What did you think about that? What makes you think that way now? Or, you know, I had them thinking on their feet. I call them out on garbage. Because if you don't call someone out on garbage that they holding on to, then they stay stuck with the garbage. But if you call them out on it, you're not enabling them. And I believe that enabling a person hurts a person. And that's why we can go back to them Band-Aids. Because I'm going to tell you about the Band-Aid real fast. The Band-Aid, this is what I discovered about a Band-Aid. If leaving bandages on too long, if you leave a bandage on too long, it can slow the healing process and encourage infection. This is called bleed through, and ideally, bandages should be changed before this occurs. Bleed through increases the danger that a bandage will adhere to the wound. When this happens, soak the dressing and coax it off gently. So even we look at a symbolic bandage that's on a wound, we could apply that to the life. Anything that's a temporary fix has to have a process to come off so that the healing can take place, because wounds must be healed. If not, they become infected. And as we can see, the infection begins to run rampant through all of the urban communities and all of the rural communities that's suffering from generational poverty. We have rules. I started teaching them like a systematic way of thinking, living. Rules are not meant to be broken. Rules are meant to be followed. And we have a real talk approach to it. Does it work? Well, we was able to start collecting data. We started Real Talk back in 2017, but we didn't collect data because we're a startup organization until 2019. And so we had 97 people a part of Real Talk for that year. We had 114 people a part of Real Talk for 2019. And we had, in 2020, as we just started, we had 60 thus far since January until March. But you know, COVID-19 kind of put it on a little damper. But what I do it online now. So if anyone's interested in seeing how Real Talk actually operates here in Dubuque, go on Caprice Jones Facebook page, or either the Fountain of Youth Facebook page, and you will see us in action. And you can join the conversation. We anticipate to have 240 people on Real Talk this year. And so now I would like to end it with some proven proof. Our mission, you know, is to basically educate individuals that's been trapped in poverty of how to come out, as well as to educate individuals that's never been in poverty of how not to become barrier burdeners.
You need the people like Caprice Jones who have a passion for bringing about positive change, and so are willing to dedicate their lives to making that happen. And then when you have people who are seeking out assistance, they're going to be drawn to people like Caprice because they know that Caprice cares.
I am a single mother of 3. I used to be an active addict. My passion is helping others and preventing someone from making the same mistakes I did in life.
We've touched hundreds, if not thousands, of lives. we're working with people that look at the Fountain of Youth as not just a safe place, but a lifeline.
The meetings are just wonderful. They're just, a lot of them are heartfelt, personalized meetings where you can relate to the other person because you've been there. You know what they're struggling with, and you feel that instant connection to them. It changed me to want to be a better dad, a more responsible person, a better person in the community.
The Fountain of Youth gives us hope. The Fountain of Youth gives us that ambition, that inspiration, that motivation. And for some of us, without the Fountain of Youth, we wouldn't have it at all. It's helped me become a better person all the way around. Like, I'm thankful and grateful for the Fountain of Youth. It changed my life.
Thank you for all watching. My name is Caprice Jones. I'm the Executive Director of the Fountain Youth Program.
Thank you, Caprice. That was so inspiring, just both your story and what you're sharing with the people of Dubuque. It's inspiring, and it's so impactful for so many. Like you said, your numbers are in the hundreds, but the lives you touch, I'm sure, surely are in the thousands. So we'll take time now for some questions and answers. So if you people, as you have questions, go ahead and type them either in the chat function or in the Q&A box on the bottom of your screen, and I will relay those to Caprice. We'll start off with a question in the chat room that says, asking how long does the program last for attendees?
It could be as short as 60 days to a maximum of 6 months. 6 months is the length.
And how is that determined? Whether it's a minimum or maximum?
Oh, it's determined because they work on a goal, and Partners in Change. They work on a goal for 60 days. That's a SMART goal. And then once they accomplish that goal, then they can choose to go to another goal. And that'll be another 60 days. Each goal is 60 days at a time, and there's only 3 goals they can work on. Now, if a person is not in Partners in Change and they just a part of Real Talk group, or they just come into groups, that's indefinite.
Okay. So you said before, as a part of your presentation, that you're really interested in working with people who are either ready for change, working on change, or walking in change. And I love that kind of mantra. How do you find these people? How do you are you working with schools or with the city, or how do people know about your program?
Well, initially we just started out with the halfway house that's down here in the 1st District. It's a place where a lot of individuals come from prison or come from probation, things like that. So that's a lot of where we get a lot of referrals from, as well as word of mouth now. You know, people from the community, the urban community, as well as schools. So we partner with NICC College and also other colleges. We've had different walks of people come from colleges and join the program as well.
Great. And so many of the people in the call here and across Iowa, we're looking at systems change. And obviously you are part of that, the systems change and wanting to prevent generational poverty. What kind of, we saw the mayor there on your video, but what other kind of...
He's city manager.
Oh, city manager, sorry. What kind of impact do you feel you're having on other leaders and elected officials in looking at the root causes of generational poverty?
Well, I believe by us being able to we allow a safe space for them to actually join in on a lot of our programs and events that we have, that they now are they're seeing it as being necessary to make big changes happen. Policies and everything has to be changed for these things to take place.
Great, yeah. We have a couple of other questions that have come in now. Wondering do your participants then, once they've completed their goals, do they become mentors to others?
Yes, so the first stage that I allow them to become is group facilitators. So they become a facilitator of a trained facilitator. They don't just become a facilitator, they become trained, and they get familiar with the culture of what we're trying to actually press in Dubuque. And so from that point on, then they can become what's called a change leader. And that's kind of like, we use that term and we strayed away from mentor, but it's the same thing that a mentor does. It's just that I encourage them and I press them to lead by example. There's no room for excuses to say, well, I'm only human. So sometimes, you know, people could use those excuses.
Right, right. So another quick question is whether or not there's age limits for your group.
Yes, 16. Well, my board narrowed it down because I said I wanted to be 16 to 123, but they narrowed it down to 16 to 60.
Okay, good. It's starting them young, and hopefully then they can pass that on to even their younger siblings as well, kind of these goal settings. Just last question here, and you'll see in the chat window when you're able to access it too, all kinds of praise for your work, and everybody's very impressed with your work. And so somebody's wondering if there are other programs like Fountain of Youth across the state. I mean, you're in Dubuque, and it's great that you're offering online programs, but are you aware of other programs or opportunities to replicate your program across the state? And do you consult with other communities who want to benefit from your program?
Well, I've had a couple of contacts in Des Moines. One of them is a gentleman named Dennis, but he doesn't do the same type of program exactly that I do, but he wants to collaborate with me in efforts to join what he's doing in Des Moines as far as with employment opportunities, as well as and I've been in talk with someone in Waterloo, but we haven't had the opportunity to really collaborate. But I'm open to collaborating with anyone, and also sharing a model of Real Talk.
Great. Well, you're still a fairly young organization, and we're happy that we're here to help get word out about your success. We will be posting this video on the IPHA YouTube channel, and Caprice has said he will share his slides with us, and so we'll post those as well. So congratulations for all the great work you're doing there in Dubuque, Caprice, and we look forward to hearing more great things from you. So with that, we are going to switch now to our second presentation. Juan Cardenillas is with Polk County Public Health, and he is going to be talking with us today about how school immunization data can help limit the spread of disease. So very timely presentation here, and I'm going to pull up his slides. I'll be switching Juan's slide, so let me get that started. He can go ahead and get started, and then Juan, I'll pull up your slides.
Hello, everybody. This is Juan Cardenillas. I'm a public health planner here in Polk County, live from Des Moines. My co-presenter, Susan Brooks, is not going, able to join us today. She's helping us with our efforts, for COVID-19. So I just want to send, kudos to her, to our team, and also kudos to all of you who are working very hard, in keeping your community safe. Now, last year, I know I feel like it has been 2020 forever, but last year, when Susan and we discussed the content of this presentation, we didn't have in mind that we were talking about an outbreak in the middle of this, humongous outbreak that we experienced. Our discussion at that time was on a different outbreak. Actually, in 2019, some of you remember, we have an outbreak that it was smaller and in magnitude, of course, but still relevant enough to call our attention and call the attention of public health in the United States. It happened that we have the measles outbreak. Some of you might remember that. It was actually the largest outbreak that happened since 1992. 31 states were compromised. Even in Polk County, we didn't have like an outbreak per se. It called the health department as a way to, reduce some of the practice to prevent outbreaks, but also to, most important, to also how we can utilize other tools to, do the prevention. So that's how, in these conversations with Susan, and you're going to see today is that the result of this conversation is how we can utilize other data, in this case, school audit data, as a way also, as another tool that the department could utilize to do the prevention of outbreaks. Okay, so on a second slide, so this is a very simple way to put it. What is a school immunization audit? You haven't, you're not familiar with a term or with the process. You can see there is a data collection. Basically, the health department goes to the different schools in the county and they collect information related to certificates and immunization records. Sorry, are we doing okay with the presentation? I noticed that there's some changes there. I hope everything is okay. What happened is that we do the data collection, then there is a data review here in the county, and then after the data reviews process, we submit the information to IDPH as is mandated by the state. Now, we could we could finish our participation right here. But the health department, we always look for the best interest of our residents. We're looking for ways to, I think Caprice mentioned, something that he mentioned in his presentation was about the importance of data. So that's how we utilize this information to go beyond, to go a little bit further and to go some steps that could help us to understand better the status of our county and ways to, do some active prevention. Next slide, please. So as you can see, we do 5 more steps, actually. 5 additional tasks that we have been established. The first one started a few years ago, and the last ones actually are some new ones that we have been implementing since last year. So the first 3 will talk about communication, and the last 2 are about technology, technology. Immunization reports, next slide, sorry. Immunization reports actually, as the name say, are a report, basically a report that we provide to the community and partners. They give us a snapshot, the status of the immunization status in the community and, well, in this case, on the schools. As you can see, next please. Yeah, sorry, this is the medical and religious, the trends that you will see. We publish these reports to the community and they are located in the website for the health department, So these ones are medical and religious. Next slide, you will see there are provisionals and invalids. We utilize the information again to understand better, how prepared we are, what is the status, of the community related to immunizations. So that could give us some clues about there is an issue we can be prepared by having, this information. And the last, the next slide talk about what we call it, something that we call not fully vaccinated. So not fully vaccinated is basically the summary of all the medical, religious, provisionals, and invalid certificates and exemptions that we have here in the county. They give us another sense of what is the herd immunity. There is any issue related. There is we're getting close to achieve herd immunity rates here in the county. So, and again, also they give us a chance to see the immunization rates are are increasing in the county. Are we on good track? Also another trend related to that. But also we use this information to address or have a conversation with our partners, that they give us a good sense of a baseline, basically, and data that we can discuss with school nurses and school administrators. So that would be, our next slide is related to promoting collaboration. What happened is the reports, before they go to the public even, they are distributed to school nurses and school administrators. We want for them to have a good understanding, what is the status of their schools and the district. Also, that gives us a chance, to have a discussion with them. Maybe ways to school nurses or administrators could, improve the immunization, the status of their own schools. Also, we provide some guidelines and recommendations about how they can prevent outbreaks, preventable disease outbreaks in their own schools. So we submit this to the school administrators. We, has been working very well. I think since we start to do this practice, we have, have the support of these 2 entities. So I think for us, it's a very good partnership. I think school nurses are one of the best partners that we have in the community, are very important. and they are very relevant with this kind of data. The next slide, sorry, is about the idea of health awareness. You know, I think all of you are familiar with the importance of notify the community to strengthen the importance of vaccines, are how they can affect children, but also how they can affect fragile students. You know, so we want through the media to create, you know, a strength, create conscience about it, you know, motivate people to be aware about this, also to be, you know, have the support of the community. Couple of slides there, a couple of pictures we have the local newspaper called the Des Moines Register, and that's, you know, how they publish the information. Personally, for me, one of the most interesting part of this process is when they publish information in their Facebook page. So we can see, you know, what is the reaction of the community toward this. I will say that during the past years, it has been improving. I think people, at least through the comments, have been very proactive and very, I think the idea of awareness and how you know, this vaccine could affect fragile children has been working in a way that people actually aware about that, and they are very, you know, vocal, and they are, you know, at least in this case, in the moment, they're most of them, I will say, supporters of this practice. Then there is another picture, something that we have been started to do is also we provide this data to legislators, local legislators. The idea behind this is we want to provide accurate data so they could have, you know, clear, accurate information with the moment that they have to, you know, take some decisions, you know, at the capital level. So that has been working very well too. But as important is, you know, communication is good, collaboration is good, but also something that we notice in this case is the timing. So timing is also very relevant. So that's why the health department has been very proactive in the past, you know, 2 years to evaluate how we can make this report, you know, how make them available to the public sooner. You know, there is make a difference if we provide a report in January that we provide the same report you know, in March or April. You know, and by the sooner we do, we can have the attention of the school administrators, school nurses, and also the attention of the public. So that's how what we did is we reviewed the process that we conduct. And we found that it was a possibility, some chance to make changes. That's why our changes actually that we decided to do were related to use of technology. We partnered with our IT department to create a mechanism that could help us to reduce the data, you know, the process, the time that we use to generate the data, minimize human error, and also increase the collaboration, you know, and awareness, as I mentioned. You know, the sooner we can have the report in the hands of school administrators and nurses, could have a bigger impact if we went later in the school year. So the next slide talk about. You can see there is. Oh, sorry. Next slide. You can see in black and white, if you're not familiar with this process, is actually the data intake form that has been used or is actually being used by IGCPH here in our team that has been used here in Polk County to collect information from schools. We found, we did a review of this process, and we found that by partnering with IT and making this utilize a cloud and take out this pen and paper process, we can be faster and also, as I mentioned before, reduce human error. Like right now, what happened with this pen and paper is the school will go, our team of nurses will go to the schools and they will collect the information and they will enter by basically pen and paper and they do some calculations right there. Nowadays, we found that was a process that could, as I mentioned, create, was open, prone to human error. So we partnered with our IT department. They create for us this portal. Now our nurses go to the schools and they use tablets and they enter information and they don't have to concern about any, calculations, additional calculation that has to be done. That has been make the process faster. Also, that has been helping us to free some time by doing that, free some time of the nurses, but especially free some time for our, immunization administrator also for planning. So the next slide is just another example of that. You can see some of the results. Everything was put before in Excel spreadsheet. It was kind of fairly complicated to see and to follow. Now, by using technology, we can have this data right away. It's real data. In case, for example, you talked at the beginning, is the outbreaks is how, the importance of having timely data is very, relevant. We want to be prepared. We want to act in case of an outbreak, which goes to the extra step that we have done this school year, is to how we can go even deeper in the data, how we can even know more about the status of the schools. As I mentioned, at the very beginning, it was this measles outbreak that called our attention and making us think, what happened? We have a measles outbreak right now in Polk County. How we get the information? Do we have the tools? Is easy to get? Is it time consuming? And that's why we have another discussion with our IT department in the way that elaborate a tool that could help us to have the information sooner, even in a way that anybody from our communicable disease team will have access to this data. In the past, until last year, we have only one person have access to this information here in the county. It was a concern, if something happened, this person decided to take a vacation, it was somewhere that wasn't cell phone access, that could be an issue in the case of an outbreak. So what we had done, next slide, as you can see is we have captured this year information by type of vaccine missing. You can see this, the list of preventable vaccines or preventable vaccines that actually are required during this audit process. So what we have done is now we have been able to collect the information and to identify the level of the status by school and by school district. How many children are missing a specific type of vaccine. So you can see the next slide show an example of that. Right now we can see, for example, as I told you, right in the back is the portal that we have, and then the portal could generate the document for us where we can right away can see, okay, but in the case of measles, we can see how many children are missing this specific type of vaccine, how many are there, represent the percentage of students who are enrolled in the school at that time. So this is also another important tool that could help us to identify the status, but also to prioritize. If we have an outbreak and we can prioritize, we are going to talk to all schools, but we know that there is specific ones that are missing, or they have a large number of students who are missing a specific type of vaccine that is during the outbreak. We notify them, we are going to prioritize their connection with them and work with them in ways to put some preventable measures in place. So in summary, next slide. In summary, we have, with all these changes, we were concerned at the beginning, all these changes might generate some, negative feedback about the staff, by providing additional tasks, in some cases to elaborate, but it was the opposite. It has been very positive. Modern staff is streamlined the process, basically. The schools, something that we notice is they have been more invested. Because we are utilizing their data. They can see, through the reports and through other measures that we have put in place is that we are utilizing the information that they are providing to us. Also, the reduction in data collection process. We have more opportunities now. By dedicating less time to this process, we can dedicate more time for analysis and planning. And what's next? Sorry, the next one, the next slide. And what's next? Well, we have our goal at some point, as I mentioned, remember the first slide that indicate collect data, review the data, and then provide to IGCPH or to the state in this case, was they have a tool called Iris. Our goal at some point will be able to streamline the process from the tablets that we use to collect the information all the way to the state. Also, maybe utilize some, some of the data, create some maps, explore additional strategies that we can use in the community. I hope, some of you, if you have some ideas, please contact me about it. This is just a story. This is just some of the practice that we have been doing here in Polk County. We hope is by learning more about the trends that are happening here in the county, we'll be better prepared. As I mentioned, the new trend that we just started this year, we hope to get more information in the next years. It's about the type of missing vaccines here in the community. And before I finish, I want to, for anybody who is interested in this application technology, let me know. Our IT department will be more than happy to have a conversation with your department or your IT staff and see if that's something that you're interested to replicate. Finally, this is the address for our website. This is, if you go there, there is a tab called Reports and Data, and then you will find there a copy of all the immunization reports that we have generated in these past years. There's contact information from Susan and my contact information as well. I don't know. Well, I think I open for any question right now. Thank you very much again for your interest in this presentation.
Thank you so much, Juan. That was so interesting. I'm sure there's gonna be a lot of interest in how people can replicate this in their school districts and their counties. I don't know if you're familiar or not with but IPHA has recently started the Iowa Immunizes Coalition, where we're working with people across the state to increase advocacy and education and support for evidence-based decision when it comes to vaccine policy making. So this will be extremely helpful to that group as well. First question that we have coming at you is, what do you feel is the best way to get enough people and children vaccinated to ensure herd immunity? Yes, this gets back to the messaging that you were talking about.
We have a percentage already. We have a number. I believe is sorry, Saga, you're looking for the percentage that we have, we use as a baseline, or no, just overall?
The question is just in general. How are you using your messaging and messaging strategy, communication strategy to ensure people, to encourage people to get their vaccines, so that we can reach herd immunity and maintain?
Oh, I see. Something that we have, I think generating data show trends and making them available to the public have been very helpful to that. It provides a sense, maybe in some cases of urgency, to do some changes. We have been also, in some cases, facilitating some of the information, also facilitating by making the reports available. By talking to the media, also we can highlight some of the issues related to immunization here in Polk County. So I think it's another channel for residents to hear about the importance of vaccine, also how this could affect medical fragile children. That has been the other point that we have been trying to promote here in the county. It's not just related to your child. It's how this could affect other children, in the schools. And what, we also try to pinpoint what the schools are trying to do to make their children be safe. So I think for us, making the information accessible has been very, very important. We just want to be, transparent to residents and the way that they understand better to, what is vaccines. Trying to also take some myths out of this popular belief related to some of the vaccines. Mm-hmm. I hope I answered
yeah, I think so. So speaking of schools, we have another question that's come in that is asking about whether there's discussion about having doing more vaccinations in the school in addition to the flu shot, but trying to get kids who are maybe missing vaccines, get them caught up by providing the access to vaccines at the school itself.
Something that has been put in place by the county is trying to connect students to medical homes. Even, we know, like having the flu shot, for example, provides some, offer access, but we are also concerned about what is beyond that. Like for us, it's more important, if we can connect the child with a medical home, by connecting this family, this student with our local primary health care or local, health system, it could ensure that this student will have established medical home in the future. Instead just one time, a touch, we provide a vaccine and then we're not going to see the children again until next school year. So we know for some children might be challenged to establish a formal medical homes. So we have been trying to assist with that. So I don't know if we at this point we are envisioned to have more I would say activities in the schools, but maybe is more into how we can connect the children and put in, establish a medical home, formal one for them, so they will be insured from now to the future.
Great, that's a great upstream strategy. And of course, we're always concerned and want to make sure that there's parental involvement and consent whenever we're talking about medical treatment for children. And another question that's come in, and this relates again to schools and school vaccination laws, and it's something that we saw quite a bit at the state legislature this year, was talking about the exemptions. And other states, such as California, have tightened up their exemptions and no longer allow for non-medical exemptions. What are your thoughts on that approach here in Iowa?
Well, I think one of the steps that the health department has put in place, and I think we have done it, I think more active, in a more active way this year, is to provide accurate information to legislators. And the way that when they have the discussions, they will see the trends that are happening here. It's not just, when we talk about religious exceptions or medical. In the case, for example, religious exemption, there is a clear trend that every year they go up. So we don't want for legislators to have just, anecdotal, data. We want to provide a good, right and timely data, so when they make some decisions related to this, they will make decisions with, good information. Personally, I think, medical, exceptions are, certificates are for a reason. We have children who are medical fragile, and they won't be as, they can have access to, they will have a reaction if they will have a vaccine. But I think that's, for us, is our sense of urgency, or the sense of importance that we want for schools and school nurses, everybody, to be very proactive about having a good, or at least a very close number related to herd immunity. Because at the end of the day, if there is an outbreak, these are the children that might be more affected than anyone.
Right. Yeah, and I agree with you. And what we've seen at the legislature, just as a caveat on that, is that an increase, not just in the number of cases, not just in the number of exemptions each year, but we're seeing an increase in the advocacy work that is trying to, that the effect would be to weaken Iowa's immunization laws. Again, the coalition that IPHA is leading, the Iowa Immunizes, is working against that. And I invite everybody to, just put a little plug in here, everybody to follow on the Iowa Immunizes Facebook page. You can keep track of some of the advocacy and education opportunities that exist there. And one other question that's come in, and this isn't necessarily for vaccines or schools per se, but wondering if how the applicability of this approach to tracking vaccines, are you planning on expanding this to other infectious diseases with your program or other programs in the county health department?
That's a very good question, actually. I would say we were, maybe we're doing right now baby steps, but that's a very good question. Actually, this has been, sorry, I was taking a note before I forget. This has been actually our, I would say maybe the first one of the few approaches that we have been done with our IT department, the way it will be create a tool for us.
That shit might be gone by now. I think never, man.
Let's see what we got on here.
Gone, man.
It's 105.
Sorry about that one.
Oh, no, it's okay. So, sorry, what I was trying to say, yeah, that's a very good approach. We just started this collaboration with IT, so now that they have been kind to create this portal for us, go into these additional steps for us, now we can use the tablets, everything is on the cloud. I think we just open a box, we just open opportunities, a door for many opportunities. So it might be the case that we can utilize a similar, portal or approach to, like I was mentioned in the question, yeah, to other different infection diseases.
Right. I think if anything, this time frame has allowed us to think outside of the box. And I know Caprice mentioned it earlier, that there's an opportunity to innovate. You guys were perhaps a little bit ahead of the curve on that, but I think that we're going to see all kinds of innovation from here forward. So if there's any last questions, go ahead and type them in the chat box. Otherwise, I'll just...
Lina, before I forget, I just want to reply to, to say again, sorry, kind of out of words. Yeah. It happens that if anyone wants to have a similar portal or wants to see what we have done, kind of, I would say, what we have done in the technology perspective, let me know, contact me, because our IT department could replicate similar portal, could share the computer, how you call it, all the forms and the log, algorithm that they have been used, so you can use it. So it's free, like it's just a matter of that your department, your organization contact us. We'll be more than willing to share it with you. So the promise there. I hope, I don't know about this time, because, with all what we're dealing right now, it might delay some of the requests, but we hope, that at least we can start a conversation. So there is the offer there. So if anyone is interested about that, let me know.
Great. Thank you, Juan. That's one of the things that I love about public health is our willingness to just share and learn from each other. And if I've got something great, here's the opportunity for you to make use of it too. So thank you for that. And so with that, I just want to say thank you to both Caprice and Juan again. Your work is inspiring in so many different ways and so important for advancing public health in Iowa. Thank you for everybody who sent in questions to further the conversation. We learn from everybody. And with that, I'll just put a plug in for tomorrow's presentation. If I can get my thank you, I should say thank you again for your patience with my technology here. So we will be meeting here again tomorrow. Sorry, we're meeting here again every day at noon this week for what would have been our in-person breakout sessions and poster sessions, and we're doing it all virtually this year, as so many of us are learning what to do. Please be sure to check out the presentations that you missed on the IPHA YouTube channel. Those will be posted as soon as possible. And remember, we may be social distancing, but we are still together. We're still a network, and we're still colleagues dedicated to public health in Iowa. Tomorrow, Tiffany Conroy and Sandra Burke will be joining us. They will be talking about Iowa's violent death reporting system. And then Sandra will follow up with information about the